Be prepared for the questions patients may ask if they are undergoing a treatment transition, and also consider questions they may not know to ask. Be aware that how you respond, including your choice of words, may impact a patient's perceptions about a change in therapy. We will discuss these points in the next section. Patients trust their pharmacist. They trust you. Don't forget, multiple biosimilars for the same reference drugs are also not interchangeable with each other. Let's spend some time considering how our communication skills can help us meet patient needs. We have already covered the material to enable answering the questions posed here by your patient Jane, so you know the answers. Your answers to patients need to be clear and accurate and should tell the whole story. We know biosimilars are not generics. We know Health Canada says the differences between innovator and biosimilar do not impact safety and efficacy, and we also know that not all biosimilars will have the same dosage forms, dosage limits, or indications. So while highly similar, there are differences, and studies on switching, to date, have significant limitations. Some patients have been switched successfully. It is important to consider the needs and disease stability of your specific patient when addressing their questions related to biosimilars. Let's explore how the way you deliver this information can impact patient outcomes. A negative anticipation of treatment can change patient symptoms. This is called the nocebo effect. It usually happens unintentionally and can be caused by what you say or how you say it. The symptoms can be nonspecific, like headache or fatigue. This perception can affect health outcomes and adherence to treatment. As an example, some studies have demonstrated that when a patient is advised that their analgesic infusion has been stopped, even though it has not been stopped, they report an increase in pain. This is an example of the nocebo effect. Many factors beyond verbal communication can cause the nocebo effect. These include patient factors such as personality, previous experiences or beliefs, physician or pharmacist factors such as behaviors, manners, and skills, disease factors, including the drug treatment or other intervention, and the setting or how the environment makes the patient feel. Keep in mind also that the patient may have a language barrier or impaired verbal communication. In these cases, you will need to use your communication skills to avoid contributing to the nocebo effect. Let's take a moment to work through an example. In this statement, we can see how the way we say something can cause uncertainty, concern, or even fear in the patient. So thinking ahead to reframe a discussion point is good practice. Now it's your turn. Negative framing might sound like this. You should watch out for serious adverse effects, such as widespread rash or high fever. How could you reframe this statement? Reframe the statement in the text box below. Then click Submit to compare your response to an expert statement. If you reframe your statement like this, you can avoid creating negative emotions in your patient. I expect you to tolerate the medication very well. We are available at all times to discuss any symptoms or concerns, such as a fever or rash. Jane has a neighbor whose daughter self-injects a medication for her psoriasis. Her neighbor says that her daughter had a difficult time learning how to inject. How would you proceed with Jane? Remember that the nocebo effect can be influenced by factors beyond what you say and how you say it. In this case, Jane has some preconceived ideas about how self-injection will go. Ideally, you should offer reassurance of the many times you have successfully trained patients. You will want to form a treatment alliance with Jane so that she will trust your guidance and proceed with training. Ensure that the setting for the training is private, comfortable, and anxiety diminishing. Biologic medications, including biosimilars, are given in different ways. Some are infused, some are injected subcutaneously, and some are given orally. Pharmacists have an opportunity to help train patients who are required to administer subcutaneous injections of biologic medications. Back to our patient Jane, who requires training to administer her biologic drug using a pre-filled syringe for subcutaneous injection. It is within the scope of practice to fully train patients on how to properly self-inject a pre-filled syringe or medication autoinjector. Teaching the patient how to self-inject will add value to the patient experience and establishes the pharmacy as a site with expert knowledge. Ensure you and your staff are well trained to teach. Learning self-injection affords a patient a sense of empowerment and independence. Training is available from many online continuing education courses, and there's no certification required. Individual product monographs also contain specific steps for proper training technique. Ensure you have training kits for autoinjectors and pre-filled syringes available in the pharmacy for the biologics and biosimilars you dispense in these formats. Variation in device features by molecule or manufacturer requires that the pharmacist review the monograph and instructions in order to confidently train patients. Be prepared. Be sure to take the medication out of the refrigerator and leave it unopened for about 15 to 30 minutes so that it reaches room temperature. This is key to minimizing discomfort on injection, which is important to minimize nocebo effect from an unpleasant patient experience. Prepare patients that they may hear a click or a sound when they use the autoinjector, and that despite this, they need to hold it in place to complete the injection. If you would like to get a training kit, contact the manufacturer. Patients on biologic or biosimilar medications usually have chronic inflammatory conditions, cancer, or another life-altering condition. This presents an opportunity for the pharmacist to leverage specific skills to support the patient to achieve the best possible outcome. Let's examine subjective and objective measures a pharmacist can use to assess patients with regard to therapy efficacy and safety. We will use the examples of rheumatoid or psoriatic arthritis to consider the role of the pharmacist in monitoring patient disease and drug-related outcomes. Your role is important because of the nature of the pharmacist-patient relationship and the frequency of interaction at the pharmacy, which is typically more than with the medical specialist. To assess efficacy and safety of therapy, use both subjective and objective scales. Subjective measures related to arthritis can include pain, stiffness, fatigue, and functional limitation. Objective measures for these conditions can include inflamed joints, mechanical joint problems, or extra-articular problems. Ideally, familiarize yourself with scales, like the Patient Activity Scale or the Simplified Disease Activity Index to monitor subjective measures, and a Modified Disease Activity Scale 28, the DAS-28, to monitor objective measures. These scales are recommended by the American College of Rheumatology because they are accurate reflections of disease activity, are sensitive to change, discriminate well between low, moderate, and high disease activity states, have remission criteria, and are feasible to perform in clinical settings. The website shown on screen provides access to monitoring scales for arthritis. Help monitor disease activity, particularly if there has been a dose or medication change, so that action can be taken early if and when required to ensure the best possible outcome. Remember to take a holistic approach when monitoring patients. Immunogenicity is an important issue when we are working with biologics because the formation of anti-drug antibodies, or ADAs, can have detrimental effects on drug safety, efficacy, and pharmacokinetics. Asking patients about how they are feeling at each interaction and watching for increasing dosages can help identify changes in disease progression or in response to medication, potentially due to anti-drug antibodies. In the case of rheumatoid arthritis, be aware of common comorbidities such as depression, metabolic syndrome, and cardiovascular disease. You can develop these skills. Start with 1 or 2 specific scales for a specific condition and evolve your capabilities from there, keeping in mind the goal is disease remission, minimal complications, and better quality of life for patients. Remember to take a holistic approach when monitoring patients. Immunogenicity is an important issue when we are working with biologics because the formation of anti-drug antibodies, or ADAs, can have detrimental effects on drug safety, efficacy, and pharmacokinetics. Asking patients about how they are feeling at each interaction and watching for increasing dosages can help identify changes in disease progression or in response to medication, potentially due to anti-drug antibodies. In the case of rheumatoid arthritis, be aware of common comorbidities such as depression, metabolic syndrome, and cardiovascular disease. You can develop these skills. Start with 1 or 2 specific scales for a specific condition and evolve your capabilities from there, keeping in mind the goal is disease remission, minimal complications, and better quality of life for patients. Patients with a serious infection who are taking biologics will often require an assessment of risk versus benefit. During serious active infection, any anti-TNF therapy may need to be held and resumed on resolution of the infection. Be sure to collaborate and communicate with the medical specialist on the patient's behalf when serious infections happen. Each case will require individual assessment and follow-up. Another key role for the pharmacist is ensuring proper vaccination of patients on biologics to prevent certain infections. Pharmacist is ensuring proper vaccination of patients on biologics to prevent certain infections. Let's recap. Which of the following are important considerations when monitoring patients on biologic therapy? Please click on all that apply. Let's turn to the working relationship between pharmacists and medical specialists. As you know, there is a variety of medical specialists who manage the various conditions for which biologics are used, and they may work in very different ways. To the degree possible, learn how key specialists in your practice area work. Do this with a view to learning how you can help them help their patients. Know your biologics and share this information. Be a resource. The medication options can be different depending on the condition being treated. Make sure that you know which biosimilar is approved for which conditions. Think of how you can augment a medical specialist's practice. They often have limited time available for their patients, so you can assume a supportive role. Using the techniques we have described, you can help accelerate optimal disease management. Let patients know you are on their care team, and they should advise you if they notice decreased treatment efficacy, such as more pain and inflammation with inflammatory arthritis. You can perhaps assist in having their dosage titrated up by collaborating with their specialist to help minimize a potential disease flare. Continually engage patients to mitigate nocebo-related concerns and let specialists know you can help with this. Offer to screen and provide necessary vaccinations to patients being started on biologic therapies, meaning recommend non-live vaccinations, and assess needs on an ongoing basis. Keep in mind that if a patient is transitioned to a biosimilar treatment option, then the patient support program that he or she interacts with will also change. Patient support programs funded by the drug manufacturer work closely with patients to help with reimbursement, nursing services when required, adherence, and injection training. Being aware of the programs and the services they offer is another way to support your patients. When change happens, be sensitive to the concerns this may raise for your patient and be supportive. In our case study, you can reassure Jane that your support is ongoing to minimize the risk of her experiencing the nocebo effect. Let's summarize our key learnings from this course. Biosimilars are highly similar in safety and efficacy to their reference innovator. Health Canada's authorization of a biosimilar is not a declaration of equivalence to the reference biologic drug. Biosimilars are not generics. Understand interchangeability for biologics and biosimilars, and avoid unintended switching. In non-medical switching, a patient is switched from their medication to another for reasons other than the health and safety of the patient, usually for financial or payer reasons. Some studies are indicating that non-medical switching can be done safely while maintaining efficacy. It is important to understand the limitations of these studies. Third-party payers are working to increase the use of biosimilars to save money. This may involve non-medical switching. In applying payer policy, consider the molecule, the indication, and the individual patient factors. Also important are patient and physician choice. The nocebo effect can limit how effective treatments are and even dissuade patients from continuing to take important medications. Pharmacists, like other healthcare professionals, can influence the nocebo effect. By collaborating with and supporting specialist physicians, pharmacists can help bridge unmet patient care gaps. Pharmacists need to critically assess for possible bias in sources of information on biosimilars. There are many resources that can support your practice in the area of biologics and biosimilars. Many more treatments will fall into this category in the near term, so it is worthwhile to develop expertise on this topic. This slide provides additional resources for you.
Next steps. In order to finish this module, you must complete the associated CE test. To launch the CE test, return to the course outline and select the Start button for the CE